I see we're at the top of the hour, so we're going to go ahead and get started. So this is Nurse Educators Speak Out on Addressing the Readiness Crisis. My name's Dr. Heid. I am a simulation specialist here at UbiSim. I'm also a nurse educator, simulationist, and healthcare advocate with over 20 years of experience. I have the great pleasure of chairing the Anaxel Education Committee, and I work with our Odin Simulation Committee, especially with our fun advocacy of innovative teaching techniques, active learning strategies, and of course, simulation. So today's webinar topic is near and dear to my heart. And so I'm pleased to be hosting today's workshop. So we're going to go ahead and, as I mentioned, in the chat tab, please type in where you're joining us from today and how you're feeling right now. In my case, I'm coming from Ohio, and I am hopeful to hear what Maddie is going to share with us today. So go ahead, click into the chat, tell us where you are and how you're feeling. And I want to thank you all for sharing that information. Oh, I see a few big folks enjoying the snow in Chicago. And again, another colleague out west in New Mexico. So excellent. Thank you for sharing. So feel free to continue the chat. And as we go through today's program, I encourage you to ask questions in the Q&A tab. It's just to the right of that chat button. So while we're getting started here, I just want to tell you a little bit about UbiSim. So since this may be the first time some of you have joined us for a webinar, we want to thank you for being here. We like to say that UbiSim is where nursing practice gets real. Our immersive virtual reality or VR simulation platform for nursing education is the world's first designed by nurses for nurses. UbiSim's intuitive and customizable experience empowers learners to safely develop clinical judgment skills, confidence, and a heart for patient-centric care. That's who we are and what we do. And now, without any further ado, I'd like to introduce our keynote speaker. There we go. There she is. So it's my pleasure to introduce you to Maddie Lee Mason, today's very special guest speaker. Maddie is a data analyst at LXD Research and a doctoral candidate in Vanderbilt University's Psychological Sciences program. Her research focuses on technology-enhanced learning and how the constraints of basic cognitive and perceptual processes influence learning in applied educational contexts, with a primary emphasis on nursing education. As part of UbiSim's research efforts, Maddie supported the development and analysis of our survey to better understand the perspectives of nurse educators. And she is here to walk us through some of the key findings and show some video excerpts from this unique qualitative study. Welcome, Maddie.
Thank you so much, Christy. It's great to be here. Before we begin, I'd like to tell you a bit about the context of this research project. Last fall, UbiSim did some quantitative survey research with 800 nursing students and new nurse graduates. They shared their opinions and feedback about the challenges of feeling prepared and ready for clinical practice. And they're happy to share a link to that original study after this event. Almost as soon as their first survey report was published, they began to hear about the nurse educators who wanted to share their own perspectives on what we've come to call the nurse readiness crisis. UbiSim's desire to amplify their voices was the origin of this qualitative study that I'm going to present about today. And I'm here to represent LXD Research in our collaboration of this fantastic work that we're doing with UbiSim. So I'm excited to dig in, and I'm looking forward to any questions and comments you all have. So there's no surprise that understanding nurse readiness is especially important today because large percentages of new nurses are leaving the profession in their first couple of years. It's been shown that only around 9% of novice nurses are in this acceptable range when assessed by the performance-based development system. UbiSim recognizes the importance in hearing educators' perspectives to better understand the pitfalls of nurse readiness and the opportunities for change. And that's the goal of the qualitative work that we're doing with them. So with this study, when collaborating with UbiSim, there were 4 main goals and 4 research questions we had. The first of which was, how is the nurse readiness crisis perceived by nurse educators? What do they think about it? Is it an ongoing issue for them? The second question was, what do nurse educators say the primary reasons are that nursing students may feel unprepared to provide effective patient care? The third question is, why do nurse educators say they might feel they're not getting quality support from faculty? What's going on there? What are the challenges for faculty? And the fourth question is, what should we do about the nurse readiness crisis? In this talk, I'm going to walk you through our findings from these 4 research questions, but I'm hoping to leave you with some optimism, some opportunities for change based on the fantastic findings we saw and how much information we gathered from such awesome nurse educators who participated in this study. So first and foremost, LXD tends to collaborate with this survey platform called NIT. It's not just any old survey platform. The really cool part is that it's video-based responses that we can gather. So we were able to collect responses from 50 nurse educators, and as you can see on the left, they come from a variety of different roles, types of programs. But what's most important is that these 50 nurse educators had on average 22 years of experience as nurses and 12 years of nurse education experience. In a couple of close-ended questions we asked the educators, we found that when asked how prepared they think their current students are for the realities of nursing, 42% said students are at least somewhat unprepared, while 52% rated students as at least somewhat prepared. However, when we asked these 50 educators to what extent they think there are growing concerns about the readiness of new nurses entering the workforce, 96% of these educators agreed that there was a growing concern, with only 2 out of the 50 nurse educators in our sample reporting that there was not. And so there is a clear perception of a nurse readiness crisis for the nursing educators in the sample that we worked with. And as I mentioned, in this survey, we asked a number of open-ended questions where we received video responses from educators. And in the NIT survey platform, it supports qualitative analysis, where we can do some thematic analyses to see what main points surface across the board for these educators. So for the rest of the talk, I'm going to focus in 3 main categories, the first of which is barriers to readiness. So what do these nurse educators say are the primary reasons students feel unprepared? The second is challenges for faculty. So why do educators say students might not get the support that they want from faculty? And the third, as I mentioned, is opportunities for change. And as I go through the details of our findings, we're going to be sprinkling in different video clips from the responses we received from nurse educators. First and foremost is barriers to nurse readiness. And within that, we have clinical practice limitations. 42% of our 50 nurse educators identified limited hands-on clinical experience as a primary factor for lack of readiness. And a third of our educators in our sample pointed to inadequate clinical placements and low quality clinical experiences, meaning that educators were mentioning that not only are students not getting enough clinical experience, the clinical experience they are getting is either from inadequate clinical placements or experiences where they can't really test the breadth of skill sets or techniques that they would like students to be able to, or clinical judgment in general. And so let's check out a clip.
I think that the partnerships that we have with hospitals are not allowing our students to have that full range of clinical experience. And because they are a lot of times being shorted on how long they can have inpatient hands-on care, or they're being limited to 1 or 2 patients when they are on the units with the nurses once they graduate, and they're expected to take care of 6 patients, they don't have those time management and readiness skills.
Moving on to the second barrier to nurse readiness we found, which was that over half of the educators in our sample noted the presence of a theory practice gap, stating that what's taught in didactic and what students appear to be competent in the classroom isn't always translated in practice. And 28% of nurse educators explicitly mentioned the competency-based education emphasis, either that there needs to be a more clear emphasis of this to support student preparedness, or that what is helping students be prepared is the quality of competency-based education. And so let's move on to one short clip about that.
I would say that there is a noticeable gap between novice nurses' didactic knowledge and their ability to apply it. The students will binge and purge per se, and so that unless they have practiced it in clinical and have been able to apply that when they've been in a structured simulation environment or in the actual clinical setting, oftentimes that didactic knowledge goes in one ear and out the other.
Okay, moving forward. The third barrier to nurse readiness in the responses we received was emotional preparedness in students. Over half of the nurse educators reported students' inability to cope with high stress environments. And over a third of them mentioned students struggling with soft skills. That included either leadership, time management, communication, and more. And so let's listen to a short clip about that.
I work with new graduates in the hospital setting, and many times they don't seem to have the emotional preparation to separate between what they need to do and what's happening at the bedside. For example, we had a new grad crying in the corner because she was so overwhelmed that she had these labs to draw on this NICU baby, right? That ability to have that professional boundary to be able to say, yes, I'm in this emotionally charged area, but I still need to be able to do my job, and I need to be able to do these skills under pressure.
And I think that...
My apologies.
No, you're fine.
I'm so moved by these video clips. Thank you for including those. But I'm curious how the group is finding that as well, how it relates to them. So just want to remind everybody that we have the chat open and Q&A. Maddie will be taking questions here. Thank you, Maddie.
Yeah, of course. And I think that last clip really goes hand in hand with the theory practice gap as well. So students are understanding what's needed to be done, but when they get in those high stakes environments, they're not always able to demonstrate that. And so this leads us to the fourth and final barrier to nurse readiness that we found in the qualitative analysis, which was systemic healthcare challenges, including over half of educators attributed a lack of readiness to issues of expectation management. I think we already saw in one of the clips where they talked about students are only getting practice handling a workload of 1 or 2 patients, but then in the real world, they might have 6 to 10 that they have to care for. And so they just aren't getting that preparedness and knowing the realities of what's to come. And a portion of the educators also mentioned this challenge of not being able to balance academic rigor with supporting students. So wanting to prepare them, wanting to give them that reality check to know what they should expect, but also trying to be gentle and supportive to students in the meantime. And so I think there really is a balance there, a delicate balance. And that wraps up our barriers to nurse readiness. So I'm going to move on to challenges for faculty.
As you're moving on, curious if there's any questions that are coming forth from the group. And most importantly, have you seen some of these barriers in your practice as well? So go ahead and chat those in and share those. And if you have a question, please put it in the Q&A and we'd love to answer that.
Yeah, absolutely. So for challenges for faculty relating to why educators think they aren't getting the support that they need from faculty, one of them, to no surprise, is faculty shortages. So according to 42% of the educators in this sample, rising student enrollment combined with faculty shortages leads to this unbalanced faculty-student ratio that makes it difficult to uniquely provide each student a faculty member has quality mentorship. So this just goes to show that educators are getting more and more students that they want to provide quality mentorship to, but it's just really difficult to do so.
The biggest constraint on nursing educators' ability to provide the students with this support is time and the amount of students that we have often. Having 8 to 10 students in a group when you are in a massive facility doesn't allow you to do much more than 1 hour a day with each student, rotating throughout the day. So how do you grow that many students in that amount of time and make sure that they're getting everything that they need, but also help them troubleshoot?
All right, moving on to our next challenge, which really goes hand in hand, I think, with faculty shortages, and that's the role complexity and the workload of faculty. So 68% of educators reported that time constraints and workload make it difficult to provide students with that quality support. So as we know, educators wear a number of hats, whether it's research, clinicals, course didactics where they're grading or contributing to course development. There's a lot going on that leads to this difficulty in being able to provide nursing students the amount of mentorship that they would like to. So let's watch a short clip about that.
For faculty educators, it's the burnout. I mean, we're burned out. We're trying to balance curriculum and accreditation standards. We're overregulated. We have resource constraints. The diversity of our students and their unique needs is so very different than it used to be, and there's not a lot of support or resources to navigate that.
And moving on to the final challenge for faculty, I think this relates to one of the questions I saw in the Q&A, which is what surprised you most about your findings? I think seeing how 60% of educators reported that while students may feel unsupported, a major contributing factor is students' own lack of accountability and proactiveness in their education. And so I guess I wasn't necessarily expecting to hear that, but it makes a lot of sense because educators were talking about how students may or may not be attending office hours, or they don't come to an educator for help until after they failed. And so with all these constraints in terms of shortages and workload, educators can't always seek out and proactively help students before they necessarily know that students need the help. And so I think there's a space there where educators can be a little bit more transparent with students about this and maybe can provide that support in terms of soft skill development as well, communication and emotional preparedness. So let's watch a short clip about that.
And even getting students to participate in coming to see me for tutoring has been a challenge. I can't be there every hour of every day, but I feel like even when instructors put themselves out there, is that instructors aren't utilized. And I think that's the big challenge, is how do you help students realize that there is help for them, but they have to take the initiative and they have to seek it out.
Okay, and the final main area in terms of findings is opportunities for change. One of those is expanding hands-on clinical access, and educators described this in a number of ways. Some of them included increased access to diverse clinical placements, and others described expanding nurse residency and preceptorship programs to smooth the transition process. Some of them described the idea that novice nurses are really being preceptors for novice nurses, and it leads to this cycle of inadequate training. And so getting to focus more on expanding and increasing the quality of these training programs can be a helpful opportunity for change.
Classroom and didactic is great, but they have to have hands-on on the floor. If I go back in time, nursing school used to be 4 days a week, 2 days in the classroom, 8-hour days, and 2 days, 8-hour days in the work environment, in clinicals. We are down now to 1 day of class, 1 day of clinicals. That's not enough time.
And moving on to the second opportunity for change, which I already touched on a little bit, is enhance emotional preparedness. Again, this was discussed in a number of different ways from nurse educators' responses, which included increased mental health resources, emphasizing quality competency-based education more, and explicit training to promote soft skill development. So having these transparent conversations about what it takes, the realities of nursing, but preparing them, not scaring students off necessarily, but ensuring that they have that information they need to be successful. And so let's listen to one short clip.
They don't know the reality because they're going to clinical for 12 hours, and then at 3 o'clock someone is magically rescuing them off the unit and talking to them about their feelings and what do they know about heart failure for the one patient they cared for, instead of the reality of them. And that is something that the program that I do work for is trying to change, where from the beginning they're taking care of multiple patients and they're staying the full 12 hours and they're going to oncoming report and off-board report.
Okay, and the third opportunity for change is supporting faculty development. So over 3/4 of the educators in our sample advocated for the need to place funding towards educator recruitment, salary enhancements, and faculty development opportunities. But I think what's really important is that 1/3 of them mentioned the desire for more faculty mentorship. They weren't just advocating for themselves for a higher salary, they were advocating for more training because they want to be better mentors and they want to provide quality training. They just have limited time and limited resources to do so.
If you want to attract new nurse educators that are qualified and want to stay, then you have to provide for them when they get there. You can't just let them loose. You have to have an onboarding process that promotes their independence, but also their development, just as you would in the hospital with onboarding a new graduate nurse.
And then the final opportunity for change that was discussed in our responses was leveraging simulation and virtual reality. Over half of the educators in our sample mentioned simulation and virtual reality support student readiness, and 28% mentioned the need to invest in more virtual reality and simulation technology.
We have been using lots of simulation in the nursing program I teach in. And the students really love this because they're able to actually take care of a patient without the risk to the patient. They can make mistakes. It's okay because that's what we're here for, is to help them work through them so that they don't happen in clinical setting. We are starting to do virtual reality in my program, and that's to begin in the spring semester.
Okay, so I've thrown a lot of percentages at you. As you can see, there's so much interesting work and findings that come out of all of this qualitative data, but I think there are a number of call to actions that we can end on. The first of which is for educators to find ways to provide students with the opportunity to talk about their clinical judgment abilities and to practice them and preparing emotionally. So as I mentioned before, having these transparent conversations with students, finding opportunities to assist them. For administrators, investing in professional development for faculty, especially new instructors. And then finally, for policymakers, expanding access to high quality clinical placements for students. And to
I would ask those students just to seek out for more guidance, and that understand that we're there to make them successful. That is my goal, is to help them to achieve their dream of being a nurse.
And that's just one final clip to wrap things up on how motivated and passionate all these educators who completed this survey were towards their students. And we really appreciate their participation.
That's wonderful, Maddie. Thank you so much for sharing. We do have some questions from the audience. So the first question I'm going to start with here, there was a question about comparable studies in the European healthcare system. Have you found anything similar to what you've investigated here in that context?
That's a really great question. I think, at least from my background in nurse education, which a lot of what I do is simulation training and support clinical judgment, there's nothing that comes particularly to mind for me. But if there hasn't been something done similar, I think it would be really great to see how geographically things may vary, or better understanding perspectives in a comprehensive manner. So I think that's a really great point.
I agree, Maddie. I think that's a great question. Thanks for posing that. I think you already addressed this. What surprised you most about your findings?
Yeah, as I mentioned, I think something that hadn't come to mind for me was this proactiveness and accountability. And I think that's a really good example of where there's a possibility for space that can provide transparent conversations between educators and nursing students. So the burden doesn't feel entirely on faculty, but the burden also doesn't feel entirely on students. And so I think the balance is tricky and there's no easy answer. But in the findings from this study, I think, as what seems to be mentioned in the chat, discussion about it is a really, really good starting point, and it can move the needle forward in that sense.
Well said, absolutely. And I love the hearts that I'm seeing in the chat. Thank you guys for sharing those as well. It seems that it's resonating with many individuals. To that point, one of the questions that we have that Sasha asked was, what are the expectations on the side of the employers or the students? Can you just clarify that for us, Maddie?
Ooh, that's a great question. I think in terms of what the responses were, I think the expectations were of the employers, but there was an imbalance between what the students coming in as a novice nurse, what their expectations are, and then they vary from what the expectations of employers are. And so I don't know, Christy, if you can speak on that in terms of on the ground, but I think that just sort of adds to the idea of being able to have transparent conversations is important, so there isn't that gap in communication and expectation.
Absolutely. And I see some folks are in here as well, kind of chiming in. I find that there is a gap in those expectations. And just like anything else, if we aren't clear at what is expected, just like any good learning objective or competent behavioral outcome, right, for our competencies, if we don't know what we're going for, if we're not looking for the same goal, then we're likely not going to have the same expectations, right? So clarity in that. Great point. And the last question that we have in our Q&A from Lee is, there data for different settings of the educational environment, BSN or ADN?
That's a great question. So we did collect demographic data in that sense, but because we only had 50 nurse educator responses, we combined them all. Because getting themes across the board was most important, looking at all 50 samples, but I think future work should absolutely look at differences within different types of programs and education settings.
Excellent. Thank you so much for sharing with us these exciting findings, and excellent to know, and many said that it's not just in their institution, it's not just what they're feeling, it's across nursing education, at least in this study demographics that you investigated. So as we kind of conclude today's session, we want to quickly mention throughout 2025, UbiSim is stepping up with a mission to bring attention and advocacy to the critical role of nurse educators. We'll be doing our best to empower nurse educators with solutions like VR simulation and foster support to address the challenges they face through webinars, shared content, and a community. We hope you'll join us on March 6th for our next webinar. With that, we want to thank you so much for joining, and thank you so much, Maddie, for sharing your research, for engaging in this important conversation. And we appreciate all the work you're doing, and good luck as you complete your candidacy. I know it's coming up quickly.
Thank you. Thank you. I appreciate that. And thank you for having me. It's been such a learning experience for me as well. So I appreciate it.